Clavicle fracture. The clinical presentation of clavicle fracture is there will be sagging of the shoulder, tenting of the skin over the clavicle, shortening of the clavicle. Epidemiology. It most commonly occurs in children and adolescents, particularly affects males between 30 to 20 years of age. Most common birth trauma in newborns. Etiology. Direct trauma, fall onto the shoulder, most common cause, for example from bicycle accident, or direct blow to the clavicle, for example from a football tackle. Indirect trauma mainly falls onto an outstretched hand. Birth trauma is also a cause of clavicle fracture. Pathophysiology. Most common site of fracture is the middle third segment of the clavicle because its weakest point is at the junction of the middle and lateral third of the clavicle. Medial one-third 5%, middle one-third 80%, lateral one-third 15%. Clinical features: sagging of the shoulder due to downward distracting force of the weight of the upper limb on the lateral fracture fragment, tenting of the skin over the clavicle due to the upward distracting force of the sternocleidomastoid on the medial fracture fragment, shortening of the clavicle due to the medial distracting force of the pectoralis major on the lateral fracture fragment. Do assess for neurovascular compromise and compartment syndrome. Tenting of the skin. Diagnostics. X-ray and two projections. Ultrasound can be done in the case of suspected clavicle fracture in children to avoid radiation exposure. Clavicle fracture. Clavicle fracture. Clavicle fracture in lateral one-third. Treatment. Mid-shaft fractures. Mostly conservative treatment, for example, simple shoulder sling for 4 to 6 weeks. Exception: excessively shortened or displaced fractures require surgery. Lateral fractures. For stable fractures, conservative treatment, for example, simple shoulder sling. Unstable fractures, surgical fixation, for example, tension banding, clavicular plate, is typically indicated. If needed, ligament repair. Medial fractures, conservative treatment, for example, simple shoulder sling for 4 to 6 weeks. Displacement is uncommon in medial fractures due to strong ligamentous attachments. Shoulder sling, fixation using tension band wiring, fixation with intramedullary nail, fixation using clavicular plate. Thank you.